are there differences in the different TMS devices? There are definitely differences between the different TMS devices. In fact, you can think of all the devices that are FDA approved, which are about 7 or 8 at present, divided into 2 categories based on the particular type of coil that they use. All but one of the devices use a standard coil called the figure of 8 coil. The figure of 8 coil is an older coil. It works quite well, but it has serious limitations, and those limitations are the fact that it's not able to penetrate very deeply into brain tissue, and therefore it only stimulates a very limited amount of the brain area that we are targeting for rehabilitation. It also only is able to stimulate a small circumference area in the area that we're trying to target. And therefore, it's quite possible to miss the optimal area because it's slightly individualized from patient to patient. There's one device called the Brainsway Deep TMS device that has a patented coil design which came out in the year 2013 as FDA approved, and to some extent overcomes those limitations of depth and circumference. The Brainsway coil, which is called an H coil, is able to stimulate larger volumes of the brain area that we're targeting, both by going deeper and by going wider. And recently, a head-to-head comparison between the figure of 8 coil and the H coil conducted in Europe demonstrated that patients who were assigned to get treated by the Brainsway H coil actually had better outcomes and also somewhat faster outcomes. Academia, we now use the Brainsway H coil and have been using it for the past almost 10 years now. I was the first one to adopt the H coil when it came out, as I was the first one to start offering TMS in 2008 when the first figure of 8 coil came out. Seeing differences in the 2 devices, I stopped treating patients with the figure of 8 coil device and have since exclusively gone with the Brainsway H coil, feeling that patients get stronger rates of improvement with that coil.